Try this test to see if you have a disc herniation, and then I'll show you how to fix it. Disc herniations are an extremely common source of low back pain and sciatica. But many people believe it's a super scary diagnosis and are told that this cannot be fixed without surgery. And some lame doctor probably told you that you have to stop exercising and that you can't lift heavy ever again. Well, this is absolutely false. We have helped thousands of people diagnose disc issues and resolve them at home without any drugs or invasive procedures, and I'm going to show you how to do that today. My name is Dr. Grant Elliott. We've helped thousands around the world with back pain and sciatica fully recover through our one-on-one online coaching program. And in this episode, I'm going to teach you how to diagnose yourself with a disc herniation, and in 3 exercises you can begin immediately to find relief today. Well, a disc herniation happens when the inner gel-like substance of a disc called the nucleus pulposus begins to push through the outer tough fibrous layer called the annulus fibrosus and create a bulge. Or if it begins to pierce through that outer layer going all the way out, then that can turn into a herniation. And there are different degrees of herniation. This bulge or herniation can push into sensitive tissues, cause inflammation and pain in the lower back, or it can hit and pinch a nerve, causing sciatica, nerve pain, radiating down the back of the leg. This can go anywhere from the low back into the glutes, hamstring, calf, foot, or toes. It can cause numbness or tingling, a burning sensation, or a tight rubber band-like sensation down the back of the leg. Now, what actually causes this to happen? What causes that injury? Well, for the vast majority of people, this is a multifactorial answer, meaning it slowly develops over time through a multitude of reasons. One could be a lot of sitting throughout your life, a lot of stressors throughout your life where you're not doing the right movements and the right healthy habits to counteract the stress that's taking place on your lower back and your discs. But this can also be affected by your diet, by your mental health, by other stressors in your life, by poor sleep. All these different variables can affect one's experience with pain. And perhaps if there's a particular week where you've had a lot of stress on your lower back, you've been eating poorly, sleeping poorly, a lot of psychological stress, that could be the week where the straw breaks the camel's back and now you experience back pain, and a disc herniation that's always been there is now active and causing you symptoms. Other scenarios we do hear a lot are more acute, where a client will come to us and they will say they were in the gym, they were either deadlifting, squatting, and they felt a pop in the lower back. The next day it was really difficult to stand up straight, they're hardly moving. That's a very classic acute scenario of a disc herniation that we treat online all the time. So how do you know for sure if what you're dealing with is a disc herniation? Well, here's a very simple test that you can do at home called the seated compression test. To perform this test, find a chair that you're able to grab the sides of. You're going to sit nice and tall, keeping your spine totally straight, pulling yourself straight down into the chair. This is compressing your back, but in a neutral position. Think about if you have pain and see how it feels. Now, round your lower back, pull yourself into the chair again. Did this significantly increase pain as compared to the neutral one? Then likely you're dealing with a disc herniation. The reason being is because a seated flexed position increases pressure on the back side of a disc, and a majority of disc herniations are posterior lateral or posterior bulges. Meaning if we stress the front of the disc, then pressure can migrate backwards, increase pressure on the backside where the injury is, and therefore increase your pain. And the most common type of disc bulges and herniations are ones where flexion, bending forward, is going to exacerbate your symptoms. Now, this becomes even more likely if you notice that the longer you sit, the more you feel this. Coughing or sneezing increases your pain. If you have been sitting for a long time and you go to stand up and you feel 80 years old standing up straight, like it takes a few steps, or if you have any degree of sciatica, pain shooting down the leg, then this is extremely likely you are in fact dealing with a disc bulge or herniation. But do not worry, because you have a 97% chance at resolving this without surgery by following the right rehab plan. And this is what we specialize in. This is all we do. So I have 3 awesome exercises that you can execute now to start to resolve this pain. The first exercise we're going to do is called a reverse lumbar extension. So get out of that chair that you were just sitting in to perform that seated compression test. You're going to rest your upper body on that chair, scoot your knees back. Now push your hips forward and down as to push your lower back into extension while keeping the lower back and glutes totally relaxed. Perform this repetitively, assessing how deep you can go, attempting to go further over time. If we're dealing with a flexion intolerant disc issue, meaning bending forward makes it worse, then by doing the opposite, we can reverse that stress on the disc and slowly put that disc back in its home where we want it to go to improve your mobility and reduce your pain. This can reduce pressure on the disc, which can reduce pressure off the nerve and reduce your sciatica as well. Now for the second exercise, let's focus on the hips, because if we have tight restricted hips, that can put more stress on our lower back and affect our recovery. So we're gonna get on the ground in what we refer to as our 90-90 position. And for many of you, this will be tough to do. So we're gonna use our hands to support ourselves. In this position, lean back, supporting yourself with your hands, rotate your knees up towards the sky, creating the biggest circle with your hips that you can, rotating to the right and then back to the left. The goal is to sit as tall as you possibly can, as to make the biggest circle you can within your range, as to expand the hip range of motion over time. This will totally unlock your hips. You'll feel way more free after, and your lower back will therefore not be as stressed as a result. And all the muscles of your hips that might be tight and locked down are gonna be released too. Now for the last one, we want a strength and stability movement for our hips, for our piriformis, where that nerve can come through. A fantastic exercise to work on hip mobility and stability is called our kneeling airplane exercise. Once again, using that chair, whichever leg has sciatica or is the one you wish to target, that's going to be the down leg. You're going to extend the opposite leg straight out, trying to keep your spine neutral like a tabletop. Now what you're going to do is you're going to rotate that floating hip down towards the ground as far as you can, as to stretch that outer piriformis glute muscle. Then once you've stretched that glute as much as you can, now you're going to squeeze the glute and contract it as now you rotate that free leg towards the ceiling. The goal is to be opening and closing like a book through that hip, getting as much of a stretch as possible as you rotate that free hip towards the ground, and then as much as a rotation and contraction as possible as you rotate it towards the ceiling. This is stretching and strengthening your piriformis at the same time, a lot of your hip musculature, and improving your hip control and mobility as well. These three exercises will help you reduce your disc herniation and pain fast, but there is still one thing that you are missing. And this one thing will absolutely hold you back from finding complete recovery the fastest way possible. And I know that because this one thing has helped most people on average achieve 37% reduction in their pain within one session, and others complete pain relief within as little as 15 days. And these are chronic back, disc, and sciatica issues. And this one thing is our centralization process that tells us exactly what is causing your pain and the specific exercises you need to get fast, lasting results. So if you want to ensure that you have the right plan for you, then you can dive deeper with me by simply texting me the word pain to 317-751-9509, and you can get a tailored step-by-step plan to permanently fix your back or sciatica issues following our centralization process. Do it right now so you don't miss the opportunity to finally fix your pain and live the life that you deserve. And after you text me, please like the video, subscribe if you haven't already. Follow me on Instagram at RehabFix for more free daily videos and insights into my life for what I'm doing to maintain a bulletproof back. Thank you so much for watching. I'll see you on the next video, and I'll see some of you in our program real soon.